Welcome, everyone. Good morning, good afternoon. Thank you so much for joining us today for the launch of the US Social Isolation, Loneliness, and Connection Ecosystem Map and the inaugural State of the US Ecosystem Report. We are so glad to see such a wide range of practitioners, researchers, funders, policymakers, and community leaders here today. My name is Prashir Basricha, and I'm an Associate Program Manager at the Foundation for Social Connection. And at the Foundation, in the true spirit of the work that we do, we like to start off our meetings and webinars with a moment of connection. So given the topic of today's webinar, we invite you all to drop in the chat your name, where you're calling in from, any relevant roles or affiliations that you'd like to share with the group, and one hope that you have for this work in 2026. I'll give everyone a moment to drop their answers in the chat. While you're doing that, here's an overview of how we'll spend our time together today and some housekeeping items. We'll begin with some opening remarks from the Foundation's Executive Director, Jillian Rakusin, and some background information for why we developed this map and report. We'll do a quick live walkthrough of the US SILC Ecosystem Map. We'll then share a high-level overview of themes from the State of the US Ecosystem Report. That'll be followed by a fireside chat with leaders who are working across this ecosystem on some of their key takeaways from the map and the report. And then we'll wrap up with Q&A and some closing remarks. We encourage you all to keep connecting in the chat. Thank you all for dropping in those notes. We'll be using it to share links and resources that come up in our conversation. If you have a question, please use the Q&A feature in the bottom navigation bar. And just to note that we will be recording today's session for those who might not be able to make it, and in case you want to watch it again, and sending it out to everyone who registered, including any resources that we mention. And with that, I will pass it over to Jillian for some opening remarks.
Thank you so much, Prashir. Hello, everybody. Happy Wednesday. Great to be with you all. Really excited to be together as we celebrate the launch of the Ecosystem Map and Report. My name is Jillian Rakusin-Kornmeyer, and I have the privilege to serve as the Executive Director of the Foundation for Social Connection, where our mission is to advance social connection nationwide, rooted in evidence for our collective well-being. And we envision a vibrant society where social connection is at the heart of how we live. I want to acknowledge our friends and colleagues on the call that are active members of this ecosystem, as well as the Foundation team who led the work on the map and report. Thank you, Prashir, Morgan, Shannon, and Finley, and so many others. And we want to start off today's conversation by just taking a step back and grounding us in the why. Why did we do this important exercise? Over the past several years, there's been growing public awareness, research, and interest across sectors in advancing social connection. You see this reflected in the US Surgeon General's 2023 advisory on our epidemic of loneliness and isolation, the WHO's Commission on Social Connection and Report, which began its mandate in 2024, and the first Social Connection in America report late last year. With all of this has come a lot of growth in the number of individuals, nonprofits, and organizations that are dedicated to our shared mission of a more connected society. But we know that growth alone doesn't guarantee impact, and that in the true spirit of this work, it's not just about doing more, but it's about doing it together in a more coordinated fashion. In 2024, the Foundation went through a strategic planning process where we heard from a number of stakeholders that visibility and coordination were vital for the success and forward momentum of this work. And so in response, we committed to visually capture the growing ecosystem. I will now welcome Prashir back to share a bit about the process of developing the map and report. Back to you, Prashir.
Thanks so much, Jillian. And so in 2025, we set out to better and understand and visualize this ecosystem. And so that involved a survey of more than 60 entities across the country who are working at all levels of society to advance social connection. In addition to sharing information about their work, they also shared their reflections on the ecosystem's strengths, challenges, gaps, and needs in terms of resources and support. And so we identified these entities using 3 inclusion criteria, which were having a relevant focus, being active in the ecosystem, and working within a US scope. And we want to acknowledge here that there are a lot of entities doing amazing work in SILC-related concepts like belonging, social cohesion, and civic trust. To make the scope of this first version of the map and the report manageable and to be of most value to those entities that are explicitly addressing SILC Only entities with an intentional focus on SILC have been included in this initial version, but we see future versions of the map and the report including entities that have an intentional focus on those SILC-related concepts like belonging, social cohesion, civic trust, etc., demonstrated through their mission, their vision, or their core initiatives. And so the result of this process was these two complementary resources, an interactive ecosystem map and a State of the US Ecosystem Report. And together, these tools are really meant to increase visibility for this work, inform its priorities, and foster collaboration. So we'll start by taking a look at the ecosystem map itself. So when you click on the link to the map, this is what you'll see. On the left side is an overview of the map, which includes information about how and why it was created, a full list of entities that are included in the map, some helpful definitions, and a form to submit additional entities to be considered to be added to the map. In the center is the ecosystem itself. And so each of these circles represents an organization, a coalition, or an initiative that's working to address social isolation and loneliness. You'll notice that the map organizes entities primarily by geographic scope, so whether they operate on a local, statewide, regional, national, or international level. And this allows you to quickly see how this field is distributed across geographic reach or focus. You'll also notice that each entity is color-coded by its type. For example, whether it's an operational nonprofit, a coalition or a network, or an initiative, so you can understand not just who's in the ecosystem, but also how they show up. And so you can explore this map and the entities included in it in a few ways. You can use the search bar up here at the top to search for a specific organization. You can browse the list in the overview panel, and as you hover on any entity in the map, it'll zoom into that entity where you can click to learn more about its sectors, its roles, its population's focus, etc. Finally, you can also simply scroll and click around the map itself. You'll also notice here at the bottom that there's a population focus filter, and this helps you understand which organizations might be focused on working with specific populations. So for example, if you're interested in entities that have a focus on older adults, you can simply click that filter, and those entities that have a focus on older adults will come to the forefront and the others will drop into the back. If you'd like to use the map in presentations or materials, you can also export it as a PDF or JPEG by clicking on this button here at the bottom right. And we welcome you to use the map in your resources and materials and in the many use cases that you might see for this work. We have a more thorough walkthrough on our website that highlights some of the other key functionalities of the map. And so at its core, the map is really designed to answer practical questions like where might there be gaps for opportunities for partnership or alignment? Where might new entities be helpful to enter into the space based on some of those gaps and more? And so we know that when you put a tool out into the world, people find uses for it that you might not have even imagined when you created it. So we would love to hear from you all how you've already used or end up using the map, and you'll hear a few of those anecdotes from our fireside chat participants a bit later in the session. But we want to note that we intentionally designed this map to be exploratory. There's no single right way to use it. It really depends on your role and what you're looking for. And importantly, that this is a living resource. We know that this ecosystem continues to evolve, and so will the map. And so there is that submission form built into the map so that the field can help shape and grow it over time. But the goal is simple: to help make this field more visible, more navigable, and more connected. Alongside the map, we also developed this State of the US Ecosystem Report, and this really captures how entities in the ecosystem perceive its current health. And it draws on those survey responses from more than 60 entities working across sectors and geographies in the US social isolation, loneliness, and connection landscape. So rather than walking through all of the findings in the short time that we have together today, we'll share a few of the high-level themes that emerged. In terms of strengths and taking an asset-based approach, we wanted to first understand what the ecosystem feels is going well. And so we asked entities to rank strengths of the US SILC ecosystem. And we found that a high level of public awareness and a growing body of research and evidence were overwhelmingly identified as the ecosystem's greatest strengths. And so with this conversation moving beyond academic circles and into broader society, this really equips the ecosystem with the attention and the credibility that it needs to move beyond diagnosing the issue to actually funding, implementing, and sustaining solutions. The next section in the survey invited respondents to reflect on challenges that their specific entities face in addressing SILC. And we heard that limited funding and insufficient staff or capacity are the most significant challenges that entities are experiencing by far. And so we see this stark disconnect where public awareness and research are strong, but the ecosystem lacks the resources to actually translate these assets into sustained action at scale. And so here's where the power of predictable funding and adequate staffing would really allow entities, especially those who are operating at a hyperlocal level or are primarily volunteer-driven, to really be able to maintain their momentum, but also expand their reach, and in doing so, also be able to evaluate the impact that they're having. Zooming out past the organizational level, the next section in the report focused on challenges sort of in the broader ecosystem. And we saw that 3 challenges rose to the top: insufficient or short-term funding, policy momentum or government interest, and cross-sectoral collaboration. On the policy front, we have seen elected officials propose a wide range of legislation to advance social connection, and that includes things like the Improving Measurements for Loneliness and Isolation Act, the Community Mental Wellness and Resilience Act, and the Strategic Plan for Aging Act. But we also know that advancing policy has come with challenges in the current political environment, and that shifting priorities of the current administration have impacted progress. And so between government reductions in force and government shutdowns, some entities have found it difficult to continue prioritizing social connection and also shedding light on those communities that might be particularly at risk of experiencing social isolation or loneliness. We also heard a message from the ecosystem that the issue isn't so much that there aren't enough entities, but that they need to collaborate and coordinate better. And we really saw this picture painted of this landscape that's filled with these passionate entities, but that lack this connective tissue that's needed to help develop a shared direction for the ecosystem, cross-pollinate across sectors, geographies, and roles, and take collective action. Some of the root causes we heard from this group were inadequate federal policy, but also varying sources of funding between entities and misaligned financial incentives that can promote medically intensive services over interventions related to social isolation, loneliness, and connection. And so whether it be between researchers and practitioners or between grass tops and grassroots organizations, there's a strong desire to bridge some of these gaps that can help us have more holistic, more informed, and more sustainable efforts. While we have seen this increase in the number of nonprofits, researchers, and funders in the ecosystem, we also do know that gaps persist. And so we wanted to understand what gaps survey respondents saw based on those categories that were used to create the ecosystem map. And a couple of the themes that emerged were that we need to pay more attention to youth and caregivers. While older adults are often presumed to be the most socially isolated or lonely population, research suggests otherwise, and these findings are reflected in what we heard from the ecosystem, which highlighted other groups like youth and caregivers as being underserved. And so this poses an opportunity for new funders and other entities entering the ecosystem to really be able to maximize their impact by prioritizing specific populations. It also underscores this importance of intentionally mapping and supporting the actors who are working with these groups to avoid perpetuating any of those unhelpful imbalances and where resources are already being allocated. We also heard from the ecosystem a desire to have more state-level efforts and their value, particularly in the current federal context. And so this is where identifying state-level backbone entities, for example, like the Wisconsin Institute for Healthy Aging, for coalitions like the Wisconsin Coalition for Social Connection, could help coordinate those multi-sectoral responses on a state level and increase that impact, but also support to sustainability on a more local level. And so we know that these collective efforts can also help make a stronger case for that policy change, for example, through embedding this work into state public health agendas. Our intention with the final question in the survey was really to signal to influential entities in the ecosystem, whether those are funders, policymakers, or academic institutions, what this ecosystem needs. And so respondents were asked to rank the resources or supports that they would benefit the most from to be able to more effectively address SILC. And consistent with some of the previous sections, the strongest need of entities in the ecosystem is that greater sustained funding. And so this presents an opportunity for funders to invest in organizations' ability to absorb and apply that growing body of research that we talked about earlier, but also test new approaches where that's needed and support collective learning across the field. We know that addressing social isolation and loneliness is not a quick fix, and that meaningful, lasting change requires time and intentionality, and funding must match that. We also know that designing interventions in line with best practices that are informed by research will help ensure that both the ecosystem and the broader general public see the impact from investments in advancing social connection, which can really help to make the case to further sustain this work over the long term. Perhaps the most important part of the report is the very end, where we encourage you to think about what comes next. Knowing what you now know about the ecosystem, how might you be uniquely positioned to address some of its challenges, gaps, or needs, given the role or roles that you play? Given the need that's been identified for greater coordination and collaboration, who might you start to collaborate with or collaborate with more deeply? And finally, who in your community do you need to be paying more attention to or learn more about in terms of both their gifts and their needs as they relate to social connection? So we'll be exploring these questions and more with some leaders from across the ecosystem in our fireside chat that we'll get into now. And with that, I will pass it off to my colleague Morgan to kick us off.
Thank you so much, Prashir. And it's just so wonderful to see colleagues that we know and new colleagues on the webinar with us. I don't know if all of you can see, but there's 194 of you with us today. And there are three friends that I really want to offer a warm welcome to. We have Erica Thomas, who's the Director of Social Connection at Samaritan, New Jersey, which is a hospice care provider that does life-enhancing care across a range of home-based services, including primary care, palliative medicine, and hospice care. She develops and oversees programs and services to address social isolation and loneliness by fostering connections for vulnerable at-risk populations across the continuum. She also leads Samaritan's commitment to convening community partners across the state through the Social Isolation, Loneliness, and Connection Collaborative. Please welcome our friend Erica. I'd also like to welcome Luke Wall, the Executive Director at Only 7 Seconds, a national nonprofit with a mission to end loneliness and improve social health for youth and young adults across America. Only 7 Seconds leads the connection revolution through national awareness campaigns, multimedia storytelling, evidence-informed resources, and youth-led programs. Luke also serves as the board vice chair for the Global Initiative on Loneliness and Connection. And a fun note, he is calling in from my home state of Washington and is an active member, parent of many children, and a coach at, I think, 3 or 4 different sports teams right now. So thank you, 2 right now. So thank you, Luke, for being with us. And last but not least, please welcome Dr. Carla Perissinotto. She's a clinician and professor in the Division of Geriatric Department of Medicine at the University of California, San Francisco. Her main clinical work is providing medical care to homebound older adults in the SF area. She's also the vice chair of the Foundation for Social Connection Scientific Leadership Council and a co-lead of the NorCal Coalition for Social Connection. Thank you all so much for being with us today. I know there are many things that you all have on your plate, so it just means so much to us that you're joining us for this conversation. And to get us started, I'm just so curious, given the report and the map and kind of what you have absorbed and seen in this presentation, what has resonated with you the most from the themes surfaced in the report? And Carla, I don't know if you're frozen. Can you hear us? I think she might be frozen. So Luke, I'm going to kick it to you first to share, and then we'll circle back to Carla.
Perfect. Thank you so much, Morgan. Excited to be here. just delighted about this report. It's something that I think, Morgan, for years I've been asking you for something like this. So it's really great to actually see it come to life. And having been in this space for about 5 years now, a little over that, it's really wonderful to actually see visually the work that's actually being done in this space. So just huge kudos to you and the entire foundation team for putting this together. The thing that stood out to me maybe the most, I've been saying it for a long time, but it was really both good to hear, but also hard to hear, that one of the big key takeaways from the ecosystem gaps was that we need to pay more attention to youth and care providers. And I think that's something that I have seen just in my own experience, but it was interesting to see in a map that highlighted not as much support for youth and their care providers as I would have hoped. And so as the work that we do is really grounded and centered around youth and young adult loneliness and connection, it's something that for us, I'm taking really seriously, looking at the landscape, and also I think is an opportunity and an encouragement to organizations that are maybe addressing general public, but have the opportunity to address youth and young adults. I'll specifically highlight, it was so incredible to hear in October from the YMCA about their initiative around supporting youth and young adult connection, right? And so I think there's an opportunity for organizations like that to really lean in to that ecosystem gap right now, because we do know that youth and young adults are the loneliest demographic that exists right now. And so that was one of the big takeaways, and was really both disappointed, but also excited and not surprised that was one of them.
Thank you, Luke. I just got a note from Carla. She is reconnecting, but Erica, if I can go to you next. Curious, what resonated with you most from the themes surfaced in the report?
First and foremost, I'd like to piggyback on Luke's comments and just applaud you all for this work. I think that this map is just resource at our fingertips, information that we all needed. I will say what resonated most for me was the caregiver information, the gap that demonstrated for caregivers. At Samaritan, we have recognized that there's a need for supports for caregivers. It's a very isolating and can be a very lonely role to play in life. And being that we are a hospice and primary care and palliative care provider, we work with and support family members and caregivers just as much as we do patients. So seeing that acknowledged and that need for supports for caregivers really resonated with me. And then in addition, the need for funding as a nonprofit, it's a struggle to sometimes find where our programming fits for grants specifically. So I think that need for funding is a huge gap and definitely something to draw attention to for sure.
Thank you, Erica. And Carla, welcome back. We're so glad that you made your way back to us and the connection is strong. I'd love to toss it to you. Curious what themes resonated.
Yeah, thanks. And apparently we can't handle weather in San Francisco because it's making my internet go out. And I'm actually shockingly sitting at a desk and not in between patients. But I think what resonated with me is just the breadth of programs, both in terms of directly working with people, organizational initiatives, just thinking about how we all connect overall, and then also just seeing that the decades of research that we've done are really underlying all of what we see on the map in terms of highlighting where we have evidence and also demonstrating when we don't. I think about the work that we did in 2020 with the National Academy of Sciences and showing the gaps in evidence, and we see that in the map. And so that was really exciting and telling for me, saying that this work that I've been doing and many of us been doing for years is starting to play out, both in terms of, again, bringing up awareness, but also highlighting that the story's not over. We are in a disconnected world, yet seeing so many people here across states, across different areas where normally we don't talk to each other. Like, that's an opportunity for continued collaboration. So that's what was really exciting to me. I'm often a visual learner, so seeing the connections, the lack of connections, the opportunities in real visual form is really exciting and awesome for me.
Thank you. And you already started to touch on this a little bit, but where I'd love to go next is where do you all see the biggest opportunities for better alignment or collaboration across the field? Specifically, how do you think tools like the map help challenge the way we have traditionally worked? And I will say one of the findings that Prashir kind of lifted up and that we heard about through the survey was just this siloing or kind of working in parallel. And so I'd love, Carla, if you don't mind starting, and then we'll kind of do the reverse order. Where do you see the biggest opportunities for better alignment and collaboration?
I think there's so many different ways, but I would say a couple things is that when we see the different populations that are served or not served, that brings us an opportunity to say, hey, is this where we should focus? I can give you an example that we currently technically have a project that was just defunded by the CDC last week looking at LGBTQ older adults, but that's an opportunity to say, wow, this is an area that we're not focused enough about. How can we do that? I also see areas where we are doing research, we as in my research team at UCSF, my colleague Ashwin Kotwal, who has done a ton of work on loneliness and isolation at the end of life. And so then to see people in the field like Erica at Samaritan saying, we are actually going to recognize this research and contribute and say, yes, this is important to our patients, and we're going to do that firsthand. Like that's the translation from research into practice, but then it also means that then Erica at Samaritan can say, well, let's talk at the American Academy of Hospice and Palliative Medicine conference, or let's talk across all these different organizations to have other people not have to start from scratch but learn from what we're doing. So it's research to practice and within practice bridging and collaborating.
Yeah. And one thing I just want to point out, I'm having like an aha moment here after reading your bios and having you all on the screen with me. You all wear different hats within like the positionality that you have in this ecosystem, right? Carla, you're leading coalition work and you're practicing and you're researching, right? Luke, you sit on the global council and are an ED. And Erica, you're leading a coalition and enacting programming, right? You're already expressing the connective tissue and like that spirit of collaboration. And so like you all exemplify, I think what we hope we can see, and hopefully it's not too burdensome and you're not going to burn out quickly because we want you with us. But I just think it's really fascinating that you're all wearing multiple hats already and really embracing the opportunity. Luke, I'm going to kick it to you. What opportunities do you see? What are you maybe excited about collaborating on next in the field?
Yeah, thanks, Morgan. One of the things that really stands out to me, and I jumped right into some of the gaps that exist. And I think it's really easy. Like we hear the funding challenges, right? Like that's really easy for any of us in the nonprofit space, especially in the research space, to jump to those things, especially in today's climate. And those are all real. Like I'm experiencing those things. I know how hard they are. I think where there's opportunity, though, is when we're together. And I think that in the most recent successes that I've had around philanthropy, around funding, is when it is combined, when it is a joint opportunity and partnership, talking to funders jointly with another organization. And so as I look across this ecosystem map, I think it's really exciting to be able to start to identify like who are potential natural partners, who are ones that have an already have a deep understanding of the need and want to help work towards a solution, because these 50 or so organizations should be where we're starting, and it's a really natural thing for us to begin to partner with them. The other thing I'll just note is one of the big takeaways for us as an organization, and is an opportunity that we're really trying to evaluate. And I told Morgan last week I was sharing this entire thing with my board, because we're currently trying to determine the next chapter of our organization, and does it make sense for us to be a field catalyst and a convener and leading the space around youth and young adult social connection and loneliness, or is it to drive direct programming? And being able to even just have a landscape visual of what's going on in the world helps guide some of those conversations. And so at just a very practical level, this is something that we've been able to put to use in conversations with my board, and to be able to make decisions about the future steps of our organization.
Thank you, Luke. And one thing that you touched on that I'm going to highlight and then kick it over to Erica is the natural partnerships that could emerge, right? Like that you're already working on youth, or that there's some kind of shared way of thinking about this work. And Erica, what I love about the work that Samaritan is leading in South Jersey is that there's actually some really beautiful examples of unexpected partnerships and collaborations. And so I would love to hear from you how that has shown up in the social isolation, loneliness, and connection collaborative that you all are leading.
Absolutely. And that's actually what I was going to say is, to me, the ecosystem map really opens doors. It kind of allows the infiltration of those silos and really encourages thinking outside the box for me. It's very helpful. The map is very helpful to look at it and find organizations that do align like easily and directly and kind of boldly, but it's also it can also serve as a tool to look for organizations that kind of make like maybe we could try to develop a program. And from our collaborative, the Social Isolation, Loneliness, and Connection Collaborative that we've started, we've had successful collaborations that probably would not have otherwise developed. We've had the Animal Welfare Association partnered with a very active veterans organization. They collaborated together. Samaritan, we collaborated with the Fair Share Housing Development, and we have an intergenerational program that we're running. We ran a pilot last year. We're actually preparing to run a second program of it this year, where we have this hospice and primary care and palliative care, provider partnering with an income-based 55 and older housing unit. And we have senior residents who get to visit with fifth graders, and they made an amazing connection, and it benefited youth, and it benefited, the older population that we were working with. So it really just opens doors. To me, it allows for the thinking outside the box and just the endless possibilities.
Thank you. And I'm hearing like such positive things from the three of you. And I promise, audience, like we did not plant these comments. There was no resources given to like solicit this positivity. And we always welcome constructive feedback. We want this tool to be useful. And so I just welcome the ecosystem to really reflect back to us what is helpful, because this was put out based on a need that we understood. And I'm glad that it's meeting the needs, and we want it to grow and evolve with this ecosystem. Before I go into the next question, I'm just seeing in the chat, Erica, another Erica, not Erica Thomas, saying that ironically, she feels really isolated in this sector. And I think that is a very strong shared sentiment. And so I'm just glad that even a visual supports all of us seeing how we are so interconnected. Because it's really important that all of us really see how we can link arms and move this field forward. On that note, my next question is about what do you hope different audiences, whether that's a funder or policymaker or practitioner, take away from these resources? And Luke, I'm going to start with you. What is one thing that you hope someone takes away?
I know Carla's going to shake her head at this, but in my last number of years in this space, especially when talking with funders and people who are not directly involved in it, oftentimes the work feels squishy, for lack of a better term. You talk about loneliness, and maybe everyone understands it on a human level, but from treating it in the same level of importance as any other mental health category that we have since the last couple of decades diagnosed and prioritized, loneliness oftentimes goes overlooked. It goes, it kind of gets put in this bucket of like feelings and feel good, but not actually a real thing that can actually have solution designed around it. And so I hope that one of the takeaways from this is that there is real work being done on it, that there is a true field that exists of both practitioners and organizations that are dedicated to driving solutions, and that it does establish this field and sector as a real thing, that it is something that has real real work being done in it, both from a research and policy side of things, all the way to the program and grassroots community level. And we're seeing results in this space. And yet it's still drastically underfunded, underrepresented, and underprioritized right now. And so I think that this is truly just the beginning of the work, and I'm excited to see where it goes. But I hope that there is some encouragement about the strength of what we've started to build in this sector and where it's also headed in the future.
Yes, thank you so much, Luke. And as we begin to close out the fireside chat element of this, I just want to send a reminder out to all of our friends who have joined us. If there are any particular questions that you have for this work, if you want to start activating that Q&A function in the chat, really excited to see what questions emerge. Luke, thank you so much for sharing that with us. Erica, I'm going to turn it over to you. What is one or two takeaways that you really hope funders, policymakers, practitioners see or take away from this resource?
I think that they should just take away that, it's work harder, not smarter. It's laid out for you. These resources are here for you. Use it as a template. Use it as we're your friends in this space. Definitely also taking away that there's no need to recreate the wheel. There are programs that are successfully running. There's research to back them up. And this information, again, is right at your fingertips with this ecosystem map.
Thank you, Erica. Yeah, I think that theme felt rung so true in the survey that we saw of like, there's parallel things happening. How can we actually cross-pollinate and collaborate, but also make sure that everyone is served? Because, Luke in Washington State and you in South Jersey and Carla in California, like we can only do so much as disjointed entities, but how can we really see into each other's lanes, support it, and really move the work along? Thank you so much for that. Work harder, work smarter, not harder. There we go. Work harder. Let's not do that. Let's work smarter. Carla, I'm going to end with you. What do you hope different audiences take away?
Yeah, I mean, I think there's a couple things, but the three main points are that we are more connected than we realize. And I think with the comment that you said there, we feel alone, but actually there's a lot of us working on the same thing. That's point number one. Point number two is that much like saving democracy, this is a grassroots effort. We have to start somewhere, and we have to start with what we believe in. And that is something that those of us here recognize that. And so poll the people. If you're like, oh, wait, this organization isn't here, it's your opportunity to invite them in. And three, we have been successful in some sustained funding as a research group at UCSF because we are expanding outside the ivory tower and into the community. And by having maps such as the ecosystem, and we have one for our Northern California coalition, it's recognizing this isn't me just working with one person. It is our group expanding our impact to greater groups of people. We focus on older adults, yet we know that there's work in intergenerational health and belonging that needs to happen. And so when you show it pictorially, that tells your funders like, hey, these dollars actually go further than you realize because of the connections, because of the ability to help other organizations expand and show the great work that they're doing. And so this is where it's about. I mean, you start small. When we started some research with a peer program over a decade ago, it took a long, painful steps to where we are now with sustained funding, but you start somewhere.
Yeah, thank you so much, Carla, Erica, Luke. You all are such good collaborators in this space. And I know I'm seeing folks in the chat wanting to connect with all of you. So I hope that those connections happen. But just again, so grateful for the time for today, but also just the work that you do every day. Thank you all so much. And with that, I'm actually going to hand it back over to my colleague Prashir for the Q&A portion of our time together today.
Amazing. Thank you so much, Morgan, for guiding us through that. And thank you all for those perspectives and also just sharing some of the use cases that have already come up from using the map and the report. And I hope that that's planted some seeds for other ways that the map and the report could be used. We're going to head into the Q&A portion of our session today. So as Morgan mentioned, please feel free to continue dropping those questions in the Q&A panel. We'll start off with one that's come in looking at evaluation, hearing that this is such a pivotal resource that highlights key opportunities and strengths of the field. I love seeing all the efforts, but in the spirit of not recreating the wheel, how can we consider evaluating outcomes and disseminating both what works and what doesn't work? So curious if there's any responses from any of the panelists on that question, particular to evaluation.
Yeah, I mean, this is probably something that I can partially answer and partially the foundation, that this is ongoing work that we have been doing together as from the foundation and also through the ACL, which stands for something community living.
Administration for community
Thank you.
living.
And now I'm forgetting the name of the tool, but this has been an ongoing thing exactly to that point, is to try to figure out where is there evidence and where, like, of existing community-based programs, where is there evidence? And I think what's important here to talk about is where is there, like, I don't know what the right term to say is, like evidence that's written and evaluated formally and written up in research papers versus where is there, at least there's been some sort of evaluation of community programs to show that. So there's kind of two different ways of providing evidence. Part of the scientific council at the Foundation for Social Connection has been exactly on this topic. So this is an evolving thing. So more to come here, but you're absolutely right. I think this has been something that we've been trying to figure out, what part of this does the foundation hold versus a larger national group. If Prashir and Morgan, you guys want to add anything else, please feel free.
Yeah, I think just adding on that, Carla, like I think to me, this really speaks to that importance of that collaboration between researchers and practitioners. And an example of that is a project that we've been working through with our older adult working group, led by a member of our Scientific Leadership Council and organizations who are working to support older adults addressing social isolation and loneliness, to develop measurement tools that really get at exactly understanding the impact of interventions and how that relates to social isolation, loneliness, and connection. And so bringing together those different stakeholders to be able to help inform that group. And I see Amber exactly chiming in with that in the chat. Thanks, Amber. Eric and Luke, anything else to add on that question about evaluating outcomes and disseminating what works and what doesn't, and Morgan as well?
I wish I had a silver bullet. Go ahead.
No, I was just going to say that interesting evaluation comes up all the time, right? Because again, there's the very large research projects, and then there's what can smaller organizations do. As part of our coalition in Northern California, we've previously held webinars, and we actually just talked about it at our last meeting to do this again, is to even teach some basic tools and strategies for smaller organizations that may not have the huge research funding dollars. And we've just heard that there's a lack of funding. So how do you even think about, if you can collect anything, can you at least collect in a formal, standardized way and mix methods so that you can start to build the evidence base? It sometimes can seem insanely difficult, but sometimes it's starting small. So
I'll just
go for it, Luke.
Oh, I was just gonna note, we have found it especially challenging when it comes to youth loneliness, especially under 18-year-olds. Out of all the populations, is probably the least researched and has the least best practices around that right now. So one, if you have insight onto that, and anyone's on the call, please contact me, because we'd love to connect. We have been leading some of that work with under 18-year-olds, and happy to share what we have built so far with anyone that's interested here. It isn't something ready to publish yet, but we do have some insights into measurement and evaluation around young adults and youth.
Thanks, Luke. I also just want to offer the Foundation for Social Connection created a resource called the Action Guide for Building Socially Connected Communities, launched it in 2023. And one of the steps of the guide is actually all about evaluation and measurement, and really kind of understanding at a community level what is important for you and meaningful, whether that is quantitative or qualitative or both. The other thing that I would point us all to, Julianne Holt-Lundstad, who is the other co-chair of our Scientific Leadership Council, in partnership with Carla, authored a study, The Social Connection in America. There are a ton of resources that they're offering around the questions they use, the survey tools, etc., that I would also point us to. One thing that we at the foundation are very much focused on is how do we create common measurement so that we can really understand what works and how we're kind of seeing the state of connection across communities. I think that I want to call out Matthew Lee Smith on the Scientific Leadership Council, who worked with the Older Adult Working Group with his RACI and our basic that they're validating right now. That is one of the first tools that I have seen in this space to think about intervention and the impact of it in the moment as like a retrospective. So we're really kind of pushing this work forward. The foundation also has stepped in to partner with organizations to measure impact and are learning a lot. And as a organization that is all about creating public good for the public, we're starting to share those learnings and tools out as well. But I think to Luke's point and to Carla's point, like it's not perfect, and we're learning as we go. And so the more that we can share the survey tools and the learnings, I think the better off we are all going to be. And I think, at the very core, like there's something about social connection that is inherently just human and not quantifiable. So we're doing the best that we can to get to that level of really understanding. But there's something about like, it's like the spark in someone's eye, right? Like when they experience that satisfaction of connection.
Thanks a lot.
That's the squishy stuff that Luke was talking about.
Squishy and so important. And I'm just smiling because I'm seeing this connection happening in real time in the chat around work in youth loneliness. So we're working on that gap in real time, and I love to see it. Another question we got from Stephen: the concepts behind this map seem like they could be super useful in mapping resources in general for underserved populations. How can I learn more about how the map is constructed and what web tools are used, i.e. the technical geeky stuff? Stephen, please feel free to reach out to me after. I'm happy to share more about the tool that was used to create the platform, which has been super supportive in the process. So happy to connect further on that, and I'll drop my email in the chat. Thanks for the question. Another question that came in is looking at that point around the isolation that's felt in this field, and a question around how we can be more intentional about opening doors for early career professionals and graduate students who might be interested in getting involved in existing efforts. Any thought on those who might be interested in getting involved in this space, early career professionals or graduate students?
I have a thought is to think about the professional organizations that some of us may be a part in national convenings. I think that, and to give you an example, this is a little bit smaller group, but together with the foundation and through a grant through PCORI, where we are looking specifically at measurement for social isolation and loneliness. We have a specific component to include people that are early career researchers in this case. But if you think about other, again, I work in older adults. So if you look at American Society on Aging conferences, Gerontological Society of America, there are often subgroups within that looking at loneliness and isolation, early career people. So those are specific opportunities at national convenings. But it's also, again, incumbent on all of us to include that, that high school student, that college student that says, I'm interested in this. How can I start? Sometimes it can be like, oh my God, I don't have time to do this. But then really it's about building the next generation and continuing those cross-sector, cross-age collaborations to continue this work. I work with younger people. They make me work on Google Sheets, drives me nuts, but I learned something time.
We mean well, Carla. We mean well with the Google Sheets. Luke, Eric, and Morgan.
I'll just highlight really quickly that I think one of the most exciting things about this space is that it's still fairly small. Everyone is one connection away from another. It's relatively easy to use LinkedIn, use one person away to connect with others. It's where most people here are dedicated to connection and open to connection, right? And so I think that in my experience, I have yet to find almost anyone that is unwilling to meet or connect in some way and willing to make an introduction. And so most of us here are in the spirit of connection. And so with that, whether it's the right opportunity to connect with my organization, and maybe there's opportunities here, or I know someone who might be, I think we're all very open to connecting. And so utilize the resources that are there, connect on LinkedIn, reach out. Cold emails generally are not a bad thing in this space. Even though most of us are really busy, we really are happy to make connections and introductions. And we all here want to see this sector and space grow. And so people who are interested in being a part of it is something that we want to uplift and really give support to. And so as an aside, if you're interested in working with youth in any way, please reach out to us, because we'll find a space for you.
Thank you for that, Luke. For sure, I would just add on to that. I think nothing makes us at the foundation more happy than making some type of introduction, whether that's people that are working in the same geography or with the same priority population. It's like it's just like the best possible feeling, seeing people take connections via email and turn it into gatherings in the Bay Area or into partnerships and collaborations or presenting at conferences together. There is nothing that I love more than seeing a partnership play out that I'm not like directly affiliated or like supporting, to really see this work live out in the world. The other thing that I would be remiss not to mention is the Foundation for Social Connections Ambassador Program. My colleague Shannon has been stewarding that, and really creating space for people that are super excited and hungry for this work and want to share it with a broader audience. So if that is of interest, I think we'll pop that in the chat. And then our friend Kyle Bauer in the chat is also just pointing out regional organizations. There are tons of kind of organizations, whether it's at the state level or more local, that are doing this work. And I will also just put out there, like, the info at social-connection.org is always open to you. If you're excited about this topic, no matter where you're coming in from, we'd be happy to point you in the direction of someone that we know.
Thanks so much, all. I also want to turn to a couple questions that we got in the webinar registration from folks. And one of them was this question around capacity and burnout and how we get people to engage when everyone is feeling at capacity or burnt out. And I know this touches on some of the themes that we heard in the report through survey respondents. And I've heard a bit about, the power of collaboration and partnership to help address that. But curious if anyone has any further thoughts on how we get people to engage with that feeling of being at capacity or being burnt out in this work.
I mean, honestly, I think that it's hard. I mean, it's I can't say yes to every student that writes to me, or every invitation. At the same time, I have to practice what I preach, right? In that, if I truly believe that social connection is important for my health, then I have to make those connections. So I'm going to call out Amber Carroll, who's on the chat, who's a colleague who I met through this work, and we have now become friends. And so it's about not just, texting and seeing each other at conferences, but being intentional about, when are we getting together for dinner? And we just had to reschedule and rescheduling again. Is it sometimes the thing I want to do in the moment? No, I just want to sit on my couch by myself and not talk to anyone, it turns out. But I always feel better when I do connect with other people. So it's being intentional. It's when I think about my health, it is my physical health, it is my mental health, it is my spiritual health. And I have to do it. It doesn't happen passively. So that's it. And it's not perfect. And sometimes being by myself is actually what I need to be connected with others at a later date.
Thanks, Carla. Erica, I'm wondering if there's any words of wisdom you have for us about not getting burnt out in this work.
I like to, so my wheels are always spinning, and I'm always coming up with new ideas, new kind of programs just to try. I'm one of those people that throws something and just see if it sticks. Because even if a program doesn't develop in the way that you wanted it to, it still benefited someone on some level. And so my ideas are constantly flowing. And luckily I have kind of the opportunity in my role to try new things, to venture out, to kind of step on a limb sometimes, and that really helps. Because things are always changing, that really helps for me. And I do a lot of community outreach. So being in the community always is a break away from other things and makes my job fun. So.
Yeah, thanks, Erica. Prashir, one thing that I would add, and then Luke, I saw you come off of mute, is just the power of collaborative. So I think we all recognize that as human beings, we have X amount of hours in the day and X amount of capacity. And that burnout really happens when you like exceed what you really can do without compromising other parts of your health, whether that's family or whatever the focus is. Um, but like the partnerships with, like, I'm thinking about, for a very tangible example, with our action guide work, we would not be able to fully do that unless we had our friends at Healthy Places by Design. I'm thinking about Jamie Elliott and Phil Bors, who might be on this call. But it's really like those partnerships and the collaborative leadership that helps move things along and being able to tag people in, and the extension of capacity beyond just our organization. And I think many of you know that the Foundation for Social Connection is 6 FTEs right now. We've grown a lot, but we do a lot for the amount of staff that we have kind of FTEs for. And it's because of the partnerships, and some of them are very visible on this screen, that enables us to stay present and also energized and not whatever the opposite of burnt out is. So I just want to say collaboration is kind of key. Luke, I saw you come off with me. I don't know if that's what you were going for.
It was one of the two things that was so good. So +1 to all of that. I'll just say I have been there. I have been there recently. Like, I get burnout. I've got 3 kids and trying to run a startup nonprofit. Like, it's a real thing. One just really practical piece of advice that someone told me a couple of years ago is to find the things that remind you why you do what you do and that bring you joy. And so for me, even though it's not really in the scope of my work as much anymore, the thing that brings me joy is going and doing assemblies and spending time with kids. And so I make sure that once a month or so I get that penciled in. And so even though it may be, like, add something to your schedule, like, find that thing that actually does reinvigorate you in the space and really make sure that you prioritize spending time on that. That will help with your longevity and staying in the space.
Thank you all so much for those thoughts on how we can fill our cups and just being so vulnerable on this topic of burnout, which I know feels prevalent for folks on the call. I'll pose one final question to the group before we kind of get into some closing remarks. But another question that had come in was the role that local governments can play in supporting social connection. And so curious to hear from you all, whether it's the coalitions you're part of or the work you do in schools across the country, how maybe local government has shown up or how you would hope for it to show up in some of the work that you do.
I would say I think it's actually huge in a couple different ways, both from the awareness campaigns. I have a 5.5-year-old daughter who's in public school in San Francisco, and seeing just some signs in her school that saying, connection is important to health, like just those things to start at such a young age and recognize that that's important. That's number one. Number two, depends on how you define local. California actually has some pretty big initiatives, such as the Neighbor to Neighbor campaign, to really look at building social connection amongst neighbors. So I think a lot of it has been around, again, advocacy, but we are starting to see some of our, especially in aging, area agencies on aging, taking this topic head on and again, providing more opportunities for partnership and collaboration. So I think we're seeing it. Here in Northern California, we have ongoing discussions with the Departments of Public Health in California and Department on Aging to see, I think we're at the tipping point. I mean, we have been for a while, but I think that the momentum is there and recognition that we can't continue to ignore this, the deficits in connection in terms of our overall wellness and well-being. So there's a huge role.
Yeah, thanks so much, Carla. And I want to be mindful of time. Erica and Luke, if you have any thoughts, please feel free to drop them in the chat, but I want to make sure we kind of get to some of our closing remarks coming up here at the end of the hour. So just want to share that as we wrap up today, we encourage you all to explore the map and read the full report. We hope that they both spark ideas for coordination, collaboration, and connection. If you know of an entity that should be included in the map, we invite you to submit it for consideration using that QR code in the middle. And to get more updates on what's going on in the ecosystem, feel free to sign up for the Weekly Connect, which is our weekly newsletter. If you're interested in exploring how you can incorporate the map and its takeaways, we'd love to hear from you. Please reach out to that email Morgan mentioned, info@social-connection.org, which is also on the website. Just want to extend a huge gratitude as we come to the hour again to our panelists for your rich insights and perspectives and the work that you all do day to day, and to all of you in the audience for spending part of your Wednesday with us. There's a short poll that just appeared on your screen. We would love to get your feedback on how useful this was for you. And we want to leave you all with this proverb that really captures our hope for this work, which is that if you want to go fast, go alone. If you want to go far, go together. And we really look forward to going together with all of you to build a more connected society. With that, have a wonderful rest of your day, everyone. Take care.